so often that I'm working with my patients who have MS in the clinic or outside of the clinic, there's so many questions that I get surrounding what do I do if this happens or if I'm feeling this? And without having a solution, it often results in not exercising and isolating yourself, not participating in the things that you want to participate in. So, what I'm going to be focusing on today is basically what to do ifs. So, we're going to be troubleshooting a bunch of different situations. So, let's go ahead and dive in. Okay, so as I mentioned, we're going to be reviewing troubleshooting specific situations around exercise and physical therapy or physiotherapy and multiple sclerosis. So, for example, what to do when blank happens. And we're going to be discussing how to handle the unknowns because when symptoms get in the way, as I mentioned, it often results in just stopping and avoiding the situation, avoiding the exercise. And in the long term, that can often result in getting weaker faster, getting more unbalanced faster. So it's such a good idea to have a few solutions in your back pocket where you feel comfortable, where if this does happen, you've got something that you can do. It doesn't mean that you need to stop and not do anything. So I'm going to be running through things like if your pain or sensory symptoms are too high, if you're if progressing your exercises actually causes a flare or what feels like a flare, and vertigo. So these are the main topics that I get questions about, probably, if not a daily basis, that one of these comes in at least a few times a week. So we'll cover these, and hopefully you'll feel like you have some solutions in your back pocket. If your pain or sensation is high. So I actually reviewed this already, which was a little bit earlier when we talked about if your sensation, if you can't feel your hands or your feet. We talked about the desensitization exercises using our scrunchie and different things that we have sitting around. It's the same for pain. I once had a patient come into the clinic and she always saw me at the very end of the day because she had to work a full day and then she would come in. And normally that was a great time for her. We were able to do lots of exercises. But on this particular day, both of her feet were and legs were in so much pain and she was having a burning sensation. She was almost in tears and she said, I cannot do our normal routine today. I came anyways because I didn't want to cancel on you, but I don't think I can do anything. So what we did was I put her feet in buckets of dried rice and dried beans, and I just had her pick it up with her feet, put it down, roll her feet around, and we were just talking this the whole time as she was doing that. And after about 5 minutes, she was like, "Oh my gosh, the pain isn't in my feet anymore. It's just in my calves." She continued doing it after another 5 minutes or so. She was like, oh my gosh, I don't have any pain up until my knee. So it started slowly improving where it was lessening from the furthest point away from her body, from her toes first, and then coming back up. Now, if your pain is consistent, you would need to do this at least once a day, every day for probably many weeks. But if you're just in a situation where your pain is temporary, you know why it's bad, you had a flare or something, you can use this as something you do every now and then. What if progressing your exercises causes a flare? So I love this question because so often if you're exercising, you probably have a goal of not doing the same exercises for the rest of your life. You want to change them up, you want to progress to more challenging ones, but sometimes that can cause a flare. So my best tips to do that is to progress slower. And it can be really challenging because sometimes what is causing our symptoms to flare doesn't actually feel like it should have caused a flare. Like you might have gone, let's just say you went for a 20-minute walk and that's normal for you. So you went for a 25-minute walk and it threw your whole system off. You might be thinking cognitively, it was just 5 more minutes. Why the heck did it cause that? Like, that was not that much more. But sometimes our bodies need to progress at a really, really slow rate. So, the way that I like to recommend progressing at a slower pace is, first and foremost, only add one exercise per session. So if you're used to doing 5 exercises, don't all of a sudden add up to 8 or 10. Just add one new exercise for that session, and that's it. That's the only change you'd make that day, and see how that feels. Get consistent with that. Another option could be increase by only 3 repetitions. So often, if I have a patient that's doing an exercise, maybe 10 repetitions, they might say, well, I'm going to do 15 repetitions today, or I'm going to double, I'm going to do 20 repetitions today. Instead, only do 3 more or just 2 more. It is enough to make a difference. And not only that, but if you were thinking about adding another set, so maybe normally you do 10 times 3 sets. Instead of adding a full 4th set, maybe your 4th set that you're adding only has 3 repetitions in it. So just really slow the pace down of how many repetitions you're adding for those exercises that you're already doing. Next up is the height of movement. So if you want to progress your exercises, you could do the same exercise, but more movement, lift higher. If you're doing that seated marching exercise that I was doing earlier, where I was marching my leg up and then down, we did it just very lightly because we were doing it as our warm-up exercises. But if you're doing it as an actual exercise, the way to progress it is to lift even higher and then slowly down, and then high. Lift as high as you can. Aim for more movement. That's one way to progress an exercise, and it's the same exercise you've been doing. You also can progress an exercise by speed. So this is especially important if you have a goal of moving faster. If you have a goal of moving faster and you're not incorporating speed into your routine, you probably will not make progress towards that goal of moving faster because you're not practicing it. So these are all different ways that you can progress an exercise routine. I recommend picking one and stick with that one progression for at least a week, if not 2 weeks, maybe even 3 weeks, if your body takes a long time to get on board with changes. And then add another one. So maybe initially you're just going to add one new exercise. Once you've done that for a few weeks, you're keeping the same exercises, but you're going to aim for more movement with 1 or 2 of those exercises. Once that feels good after doing that for 2 or 3 weeks, then maybe you add in 3 more repetitions. So it's up to you. There's no right or wrong way to go about which one you add in first, but these are just some ideas. Vertigo. So, vertigo is something that I actually keep hearing of more and more recently with my one on one clients, where they'll say that when they're walking, they feel dizzy, or if they look down as they walk, but then they look up, they feel dizzy, or if they're in crowds, they feel dizzy. One potential reason for that could be vertigo. And vertigo is actually an inner ear problem that's happening. And specifically when your eyes and your inner ear don't move at the same speed, where one is slower than the other. So examples of vertigo or vision-based exercises that can help with that are, there's 4. So number 1, your head stays straight. So you don't move your head at all, but your eyes move side to side like this. And the further you go, the harder it's going to be, and the more it might make you dizzy. And actually, I should back up and say this is another desensitization exercise. So what I mean by that is it's probably going to make your dizziness or your symptoms worse at first. As soon as you start noticing that it makes it worse, you stop, wait for it to go away, do what you got to do, maybe close your eyes or keep them open, look at something big, and then do another round. Stop, and then repeat. So the 4 exercises that you can do, one is your head stays straight, but your eyes go side to side. The next is your head stays straight, but your eyes go up and down. The third is your eyes stay straight, but your head turns side to side. And again, the further you go, the harder it's going to be. The quicker you go, the harder it's going to be. So go slow and steady, not too much movement at first. And then the fourth one is your head stays straight, your eyes stay straight, but your head goes up and down. So those are some vision-based exercises that you can do that might help with dizziness or feeling a little bit off balance from an internal aspect, not because your balance isn't great, but because your inner ear system is off. So those are some exercises that you could do. You would do them seated at first. If that feels easy, it doesn't bother you, then you would progress to standing. And then you could even progress to doing them when walking, but make sure you're in a safe environment if you get to that point. How to prioritize exercises. So, if you have too many exercises, if you are someone who has been going to physical therapy or the gym, personal training for years, you truly might have a list of like 50, if not more, exercises. And you might get to a point where you feel like, well, what's best? What do I do? Where do I start? What do I focus on? Where I always like to focus is remind yourself of what your goals are. You'll stick to what you are more passionate about. So if you have a goal of walking faster or walking with better quality, walking feeling like people aren't staring at you and like looking, pointing out at the way that you're walking, then your exercises that you should prioritize are the walking based exercises, the functional, at least the 7 functional exercises that help with walking. If your goal is not walking based, maybe your goal is standing up off of the ground, pick the exercises that are designed to help you stand up off of the floor or stand up from low surfaces or squishy surfaces like a couch or a toilet seat. So remind yourself, instead of just getting in this habit of, okay, these are all my exercises I do, prioritize. Remind yourself, what are your goals? Which exercises align with those goals? And if you need help doing that, work with a physical therapist that can help you with that. But you're more likely to stay consistent about something that you are passionate about. And what we're passionate about are our goals. So if you know that these 5 exercises are going to help you walk better, and what that means for you is that you're going to be able to go for walks with your family, you better believe you're probably going to do those exercises more so than if you just have a list of 20 exercises, but you don't really know what they're doing for you, or you don't see how they're going to be helping you get outside and feel less isolated and walking around with your family. You're going out to dinner at night and navigating the restaurant to get to the bathroom. So remind yourself of your goals and develop a why. Why is this important to you? And those usually really help. Okay, the last thing that I wanted to review, this was a question that just came in, and we kind of touched on it already, but it went into much more detail. So I just wanted to read it to you guys and answer it. So the question was, do you have any general tips for someone fairly new to having MS about when to push on with exercise in order to try to combat MS motor and cognitive fatigue versus when to completely rest? So if you remember, one of the first things we talked about, I think it was the very first one, was if you're fatigued, do you rest or do you do your exercises? The second part of the same question was, I want to be proactive, but just can't seem to get the balance right since developing what I've been told are MS fatigue symptoms. In particular, because I don't feel them coming on, they seem to hit a few days after. I don't generally feel sleepy tired either, which is nice. I can no longer work out at my baseline. Listening to my body feels so much harder. Resulted in losing confidence. And this is a perfect example of, if you stop exercising, it's so easy to lose that confidence, to fall off track. So my answer, I have 2 different answers, because I think there's 2 different questions to this. One is, when do I rest versus when do I push off? And then there's also the fact of, I don't feel my fatigue from exercise until days after. And so for that, when do you rest versus when do you push, I always like to try exercising first, but lightly, using all those tips that we discussed earlier. Light movement, even from bed or from your couch. Maybe it's just upper body. Maybe it's just your core. Maybe it's just maybe 5 minutes of your legs. So exercise in a very light way. In a way where you feel like, is this even considered exercise? It more so just feels like you're moving. That's what I would always recommend first, and then see how you feel from that, because that might actually improve your fatigue. There's research showing that that can improve your fatigue. If that doesn't work, then you might actually need more rest. The way to know when you don't notice your fatigue in the moment, like you've exercised, you're fine for a few days. It's not until that second day or that third day that you feel like you've been hit by a truck, or you just feel like something happened where you're just super fatigued. Generally speaking, that might be delayed onset fatigue. And that's so tricky because when you were exercising, you felt fine. And so it's really important to track what you're doing. And this is a good strategy, but also keep in the back of your mind, MS is different every day. So it can make this really challenging. But write down exactly what you did when you exercise. So then a few days later, if you're feeling fatigued, you can ask yourself, okay, what have I done that may have caused this? And maybe it was the exercises you did 3 days prior, or maybe it was that you exercised for 40 minutes that day. And then the next day you did errands. And then the next day you cleaned your house. And those 3 days were way too much all at once. So there's lots of different variables, but start tracking, what are you doing that then led to this fatigue? And it can be frustrating because those things that you're doing probably didn't used to cause you fatigue, but now it does. But it's better to learn what your body is capable of now and comparing that to what you used to be able to do so that it doesn't continue happening. But let's just say you only exercised. You didn't go grocery shopping, you didn't do errands. It's, you know for a fact that it is the exercise that caused you to be that fatigued a few days later. What did you do during your exercises? How long did you exercise for? If it was 60 minutes, then next time, maybe try to exercise for 55 minutes. Or if it was 20 minutes, next time, try to exercise for 15. Or how many exercises did you do? If you did 5, next time just do 4. Or if you did 7, next time do 6. How many sets of the exercises did you do? If you did 2 sets, maybe do 1.5 sets. How fast did you move? Maybe move slower next time. How much movement were you aiming for? Were you really putting a lot of effort in? If so, put less effort in next time. And you just choose one of these. You don't have to make all of these changes. Just choose one and then see next time, how do you feel a few days after your exercises? And eventually the goal is that you'll find something that works for you. You'll find the right combination of the number of exercises, how long you can exercise for, how much effort you put in. Maybe it's the type of exercise you're doing, seated versus standing, or all of them standing. Maybe you sit for a few. So it takes a lot of trial and error, a lot of brainstorming, but it is worth it because typically at the end of the day, you will be able to find a routine that works for you. There's also, sorry, one final thing I'll share. I was at an MS conference recently, and they were sharing how beneficial having a reward is, specifically for fatigue, but even just in general, how beneficial it is to get our motivational loop going and our reward loop. And so we're all different, we have different personalities, but what feels like a reward to you? Like if you exercise today, what are you going to do for yourself today that will feel like a reward? And do that. There's so much research now showing how beneficial it is to have a reward, and that we will actually see faster results if we start incorporating reward versus just like checking off the box, did my exercise today. So just a thought to think of.